Today, we're digging into a hidden threat to your heart. It's not cholesterol, it's a silent attacker that just might be a huge player in heart disease. You know, it's a puzzle that has really challenged doctors for years. We're always told, watch your cholesterol, watch your cholesterol. But what if that's not the whole story? What if there's another culprit lurking in our bloodstream that we're not paying attention to? And here it is, meet homocysteine. It rarely gets the same headlines as cholesterol, but as we're about to find out, when its levels get out of whack, it becomes a serious troublemaker for our entire cardiovascular system.
So let's start our investigation. What exactly is this hidden culprit, and where on earth does it even come from?
So homocysteine isn't some kind of foreign invader. It's actually a natural byproduct, kind of like a temporary stop on a factory line while we process an amino acid called methionine. In a healthy body, it's just passing through. The danger really kicks in when it stops passing through and starts to pile up.
To really get a handle on this molecule, we've got to follow the evidence. So let's trace the biochemical trail that leads to its creation.
Okay, so everything kicks off with methionine. This is an essential amino acid, which just means our bodies can't make it from scratch. We have to get it from the protein we eat. We're talking meat, fish, eggs, stuff like that. So right away, you can see the process that creates homocysteine is linked directly to our diet.
You know, the process is actually pretty straightforward. Methionine gets activated, then it donates a little piece of itself to help with all kinds of vital jobs in the body. After it does its job, what's left over gets turned into homocysteine. It's a completely normal, predictable step in a really important metabolic pathway.
So, homocysteine is produced, but in a healthy body, it has an exit strategy. In fact, it's got two of them. And this is absolutely crucial. The problem isn't that our bodies make homocysteine. The problem is when our bodies can't get rid of it. Under normal circumstances, it's a very temporary guest, and it gets shown the door pretty quickly through one of two metabolic exits. And here are those two escape hatches. The first path is all about recycling. Homocysteine is simply turned right back into useful methionine, ready to go again. But to do that, you need vitamin B12 and folate. The second path is for conversion. Homocysteine gets transformed into a different, harmless amino acid called cysteine. For that to happen, you need vitamin B6. Two different fates, both totally essential for keeping levels safely in check.
So if B12, folate, and B6 are the keys that open these escape routes, what happens when you don't have the keys? Well, the gates stay locked. Homocysteine gets trapped inside, its levels start to climb, and that's when all the trouble begins.
All right, now we know why homocysteine might build up. But what does it actually do? How does this molecule go from being a harmless byproduct to a full-blown attacker of our arteries?
High levels of homocysteine aren't just sitting there, they're actively causing damage. It creates oxidative stress. You can think of it like internal rust on your cells. It directly injures the super delicate, non-stick lining of your blood vessels. It helps turn LDL, the so-called bad cholesterol, into the really nasty, sticky version that forms plaque. It even messes with your blood vessels' ability to relax and open up, making them stiffer. And to top it all off, it makes your blood more likely to form dangerous clots.
So when you put all that together, homocysteine is basically waging a multi-front war on your arteries. It creates the absolute perfect storm of conditions, rough surfaces, stiffness, plaque buildup, and clotting that leads directly to things like heart attacks and strokes.
Okay, now that we've seen the mechanism, let's connect this back to the real world. What does this mean for our health, and how can we actually manage this risk? The key word here is independent. That means high homocysteine is a risk factor all by itself, completely separate from cholesterol, blood pressure, or smoking. It's another critical piece of the cardiovascular puzzle that we really need to be thinking about.
And the risk is significant. I mean, we're not talking about a small, marginal increase here. A moderate elevation in homocysteine can triple your risk of having a heart attack. That's a huge number that really hammers home why this all matters.
So, what causes these levels to get so high? Well, it turns out it's a mix of factors. The most common cause is a deficiency in those B vitamins we talked about, the gatekeepers. But genetics can definitely play a role, and so can certain medical conditions like kidney failure. Even lifestyle choices and some medications can contribute. It's a complex picture for sure.
And that brings us to our final question, doesn't it? For decades, the spotlight has been almost entirely on cholesterol. But looking at all this evidence, should we be paying more attention to this hidden attacker? The really great news is that homocysteine is a risk factor you can do something about. Your level can be checked with a simple blood test. Understanding this molecule and the factors that control it might just be one of the next giant leaps in the fight for better heart health.